Okay, I think it's time to start. So good evening, everybody, and thank you for joining our webinar tonight. My name is Jaime Garcia, CEO of Crisalix, and it's really a big pleasure for me to have three worldwide key opinion leaders tonight speaking about how they manage with the crisis to not keep only the business going, but also to take it as an opportunity. And it's also a pleasure to see the big number of registrations that we got, with doctors coming from more than 60 countries tonight. So for this webinar, we will have first a round of short presentations, starting with Dr. Ruth Graf from Brazil, Dr. Alfredo Hoyos from Colombia, and then Dr. Dennis Hammond from the US. And after that, we will go directly to the questions. So for that, please use the chat functionality that you have in the Zoom conference tool. So you can write the questions there, and then we will go one by one, giving the answers from the speakers. Para los que deseen escuchar el webinar en español, pueden clicar en el botón Interpretation y seleccionar el idioma en español. For Portuguese, Ana?
Sim, para todos que querem escutar em português, mesma coisa embaixo em interpretação, escolhe o português e é importante mutar o áudio original, para que você possa escutar bem o tradutor.
Thank you, Ana. So now let's start. So please welcome Dr. Ruth Graf from Brazil. I unmute your microphone already. So if you want, you can already share the screen.
Can you activate my video?
Yes. You have to press the button Start Video from the bottom.
Okay. It's a pleasure for me to share with the two wonderful speakers, Dr. Hammond, Dr. Hoyos, and I'm going to start my presentation. Let me. Okay. It's okay. Can you see that?
Yes, we see it.
Okay. So I'm from Brazil, and I'm going to talk first about the picture that we have in Brazil. We start the full quarantine at the beginning when starting in March in São Paulo, the first patients, and it is almost 2 months of quarantine. And you know, Brazil is very large. We have different regions, as you can see in the map. We have from north to south and different aspects of the disease. So the mortality is growing up, but especially in some areas, like you see São Paulo, SP, that is the epicenter. We have more patients with the disease there, and also Rio de Janeiro, and the north and northeast. So we have more infected patients in that place. In south, where I live, we don't have too many, and in my city, Curitiba, until now we had only 30 deaths. So we start to go back to work since 2 weeks ago. And we have the health crisis together with the economic crisis. As you know, 2 months without work, Brazil like almost disappeared financially. So the economic crisis is very big nowadays. And at the same time, we have political crisis. Our president and our ministers, we have some fights between them. So at the same time, we have the political crisis. But then the good thing is that we have the online consultation allowed since April. So the last month, we have this law that they allow us to have the online consultation. So before the pandemic, the patient scheduled meet with the secretary by telephone. We had presential consultation with the 3D image. We can use this 3D image during the consultation, and the treatment could be at the same day of the consultation, like for cosmetic procedures in the office, or the patients could make appointments for surgeries for the next few days. But as you can see here, I do it in my office when the patient is with me, and I can show her which place I need to improve her face, to use fillers, and then after I do it in my office, I take the picture and I show for the patient exactly where she improved, and I can show her in each area how much is increased. So it's in the presential consultation. So during this pandemic, the patient scheduled video consultation via social media, like through the Instagram, Facebook, or even WhatsApp, and also to the Crisalix platform. So we discovered new ways to be in contact with the patients, not just stay home, but we could work by home. But we had no procedures, no surgeries in that time, but we remain active for the post-quarantine. So we could do it during all these 2 months, have more patients during this time. And after the quarantine, so now we start the presential consultations since almost 2 weeks. And
Presencial já tem 2 semanas.
We saw that we have more adoption for procedures and surgeries. And we continue to do video consultation during this period because the patients lived in another city or wanted to stay home yet and prefer to talk by video consultation. And then when she comes to my office, everything almost is ready to perform the cosmetic procedures or the surgery. So it's a new way to interact with the patients and attract also patients from another place if they don't live in another city. I'm going to show you how it works with this new platform from Crisalix. So here I have my Instagram. The patients look for me in that, and then she creates a security login. So she has a password only for her, and she creates the 3D image. She chooses the face or the breast, and this is how she does it. It's a step by step. The patient does a self. It's very easy. All patients nowadays know how to do a self and send the pictures and complete her details, names, and then the 3D is created. So after that, she would put all the things that she wants to do, like increase the mento or the nose, do rhinoplasty. And then my secretary is going to book a consultation, online consultation for her. And she sends, my secretary sent for her the exact time that she needs to talk with me. So after that, after that, we just do one click. I do and she does this one click in this platform. It's very secure, this video conference solution, because it's Crisalix has this standards, normative for this. So it's a medical standard, HIPAA, that no one can enter, just the patient and myself. And then I studied her where I need to use the the products, which one, the rhinoplast, how I offer for her. And she talked with me, she wants a little bit more or a little bit less. So this is the 3D video consultation. And how to in different scenarios like that. Before the quarantine, we had normal numbers of consultations. We have the presential consultations and normal volume of procedures. But during the quarantine, there is no presential consultation anymore, no procedures anymore. The surgeons became like, wow, my God, what can I do now? But we had these online consultations that increased patients for us. So the presential consultation come back after the quarantine. So since 2 weeks ago, I start to have patients in my office. I went back to the procedures, to surgeries. I start to do surgeries, all with very restrict rules for that. I continue to do online consultations because the patients who lives outside or who want to like hashtag stay home, they don't want until now to come to my office. So I continue to use this very secure platform. It's very safe interaction with the patients. This HIPAA and GDPR is the safe platform that only the patient and myself can enter. The pictures, no one can see the picture, just us. This is with that we have more ways to attract new patients. It's very interesting. So I would like to thank you very much to share my experience with you. Thank you.
Thank you very much, Dr. Graf. Thank you. And just to apologize, because at the beginning there were some issues with the translation, but I think by the middle of the presentation was solved. So our apologies. Now we move to Dr. Alfredo Hoyos. So I'm going to unmute your microphone.
Hello, everyone.
Hello,
Perfect.
Alfredo.
Can you hear me?
Yes.
Oh, perfect. Okay, thank you very much for the invitation, Crisalix. I'm really honored to share the speakers room with Ruth and Dennis, two people that I actually personally admire most. So thank you very much for this opportunity. We're going to speak, I'm going to try to not be repetitive about, the virtual consultations. I'm going to tell you how it changed the way that I do consults. Essentially, the idea is that we need to adapt. We are in changing times, challenging times, but I think we can extract the good things about this and literally change the things for good for us, So I think, let me explain a little bit how was the things before for me, I think the consultation was as regular as anybody else's, scheduled appointment, they fill the medical records. Usually what we did before is that we already had, like in the internet, they actually go to a website, actually fill out some of the consultation medical records and medical history. Later they have the consultation with me, so I do like face-to-face explanation, education, doubts, this kind of stuff. And later they actually went to someone else that is actually the girl that is doing all the photographs of me, and they did the 3D simulation with her, Actually, I come in later for questions and answers specifically about the 3D, but that allowed me to have a very good consult in the sense that they have a lot of time with the 3D consultations without affecting my own time. What is important about this? I already was doing a lot of consults like virtually because I had a lot of international patients, but a lot of international patients were very difficult in terms to connect, especially in video, so sometimes, if they actually are like tech savvy, we could connect with WhatsApp or to FaceTime, but sometimes they couldn't, and it was very difficult to do that with them. After that, what we started is that we started to work with this device, especially the Crisalix platform from 2015. So it's almost 5 years when I was doing that. I had I usually have very good conversion rate, especially face-to-face, but we expanded this satisfaction rate very high, like 20% more. And we have nowadays more than 840 3Ds done. What about when I was doing virtual consultations? It was a little bit more tough, so the conversion rate was very low, but with the Crisalix platform actually was very high later. So it was very good. And nowadays I can explain to the patients, it's not only about the simulation, but I can explain the anatomy, I can explain, the measurements, and I can explain other stuff. So we can see here a patient before, after, and how the simulation actually was kind of accurate. The other part was literally measuring the patient. So this is before and after. And in the patient, I can actually measure, especially for body contouring, I can measure the patient 360 degrees, and we can see the changes over time. So it's very easy, actually takes out the timing of measuring the patient actually in patients like specific, these kind of patients that are very, the changes are very subtle. You can see there, the changes before and after can be very subtle. And sometimes they say, oh, but I don't see very much the results. You can show them objectively how was the change done, how much was the change. Specifically for fat grafting was a very good tool. But what happened after the COVID-19? I think we had, the first one is what we started in panic, as usual, as everybody else. We had no surgeries, no treatment, no income, no face-to-face consultation. So in some sense, we had like, this kind of despair in the air, So the good thing about this is, as I already was a little bit tech savvy and we could do like virtual consultations, we were a little bit used to it. We could actually go along with the patients. But what happened here with the COVID-19? I think the main thing was that the patient became more tech savvy. I think that's what the key change right here. The patients who didn't manage WhatsApp, didn't manage FaceTime, didn't manage Zoom, didn't manage webinars, these kind of stuff, they started to learn because he was literally part of the adaptation. So nowadays what we see is that everything can be done with them because they already know how to use the technologies. So it was very good for keeping the patients attached to us. And the good thing about this platform, and specifically when you start like one-to-one consultation, one of the things that happen is that the patient actually is afraid that if you're in a video that somebody else is gonna see that, so it's part of the tricky question right here. Are the technologies that we use for communicating, like Zoom, like webinars, like Skype, are they safe? Is anybody can like literally hack and see a patient nude, and this patient goes into the internet, So that's how actually what the safety point right there was I think the earliest like alarm that we can ring. One of the things that was very good about this is that when you can take your pictures at home and you can upload them into the system, and this system is encrypted, actually took that thing away. Literally, when I see especially patients that want to show their body because they want to do liposuction or breast, sometimes I literally do the face-to-face through the video just to know the patient, to ask the questions and everything. But I try to not make them get naked in front of me in the camera. That's what is the purpose of this. The whole idea is that they already took pictures. I already see the breast and the body in the simulation, and I can more or less diagnose and talk with the patient about what they want. Even though we can also do measurements, we can do like the simulation and everything. But I think the key for me was this, that we can make the patient to be more comfortable with you in a virtual consultation. So how we attract the patients for this is very simple. Sometimes they contact you directly, they ask for questions in the social media and stuff. So we have mainly these these areas. You know, the main one that we see nowadays is the social media, especially Instagram, Facebook. They actually ask the questions and we direct them to the Crisalix website, and they upload the information and they upload the pictures, and we can see more than less, and we can schedule the appointments based on that. So it's very good because we can schedule them. We can actually go back and forth. If, you know, let's say that they want the consult at 12 and I cannot make it at 12. So I just move them and say, okay, I cannot make it to this time, but I can make it to this other time. So it's very good in that sense. And we actually keep in touch by email later. What is important about this? You know, I think the virtual consultations are here to stay. I think they're going to change for at least 2 years the way that we do consults, you know, because every time that we see a patient face to face is a risk for us and is a risk for the patient. You know, we are actually making the patient to go outside to see you. We have to encourage to have like different methods to increase the security in the consultation room. So I actually moved completely to virtual consultations. All the consultations, even if they live here in Bogota, they're doing nowadays the virtual consultation. We actually just see them just before surgery. We're just planning. Nowadays in Bogota, and specifically just in the country, we cannot do surgeries yet. So the whole idea is that we are preparing the patients. We tell them, okay, maybe for these and these dates, we may be available for doing surgeries. So we can go back and forth. We can schedule another consultation if they have more questions. But I think what is important here is the opportunity that we had, you know, essentially happened the same in Colombia, like in Brazil, like Dr. Ruth Graf actually mentioned. You know, virtual consultations were in a very gray area in terms of legality. You know, it was not completely legal to do virtual consultations because there are a lot of problems with that. You know, with this virtual consultation, we did 3D imaging. We are pretty much protected. The software is encrypted. It has like military grade encryption, so it's very good. And on the other side, it was the legal part. You know, in Colombia, after they started the quarantine and everything, they started to bring solutions to these problems. So the good thing is that it's already legal, it's already good, and we have a very good solution for our patients. So I think the social distancing is gonna keep, you know, going for a very long time. I think it's gonna change the way that they will live for a while. I think even afterwards, I think we're gonna keep with the results of this pandemic. So I think this is actually going to maximize the benefits for us and our patients, and specifically keeping you know, coming in a safe way. Thank you very much.
Thank you very much, Alfredo. Okay, so now we go for the last presentation from Dr. Dennis Hammond. Remember that after this presentation, you can we will go to the questions and answers. So you can start already now writing your questions in the chat. So I'm going to unmute Dennis. Yeah.
Good evening. Good evening. How is everybody tonight? It's good to see you. It's great to be in the same time zone with you, Alfredo and Ruth. Usually we're jet lagged when we see each other in Europe. I would just echo what's been said. The 3D consultations have really changed the way that we've gone at our practice now, because, you know, we are in a war against COVID-19. The economy is suffering. Many clinics are suffering. As Alfredo said, social distancing is probably here to stay. And we need to connect with people. We connect with people more time in their home. And it's really a way to differentiate, to better attract patients, so we can stay in touch with them. This is really an opportunity. I think that this technology has been building. It's been building, but we never really had the push to incorporate it into our practices. I know I didn't anyway. And now all of a sudden we were forced to become virtual consult experts. And thank goodness the technology was there. And in particular, I've been using the Crisalix platform. I've known Jamie now for, seems like 10 years, when watching you make this Crisalix project go, and it is just outstanding as far as we are concerned. mostly for me, which is a breast practice. So my consultation before all this started was a patient would come to see us for our initial visit. There would be a history. I'm sorry, I'm going to back up just a bit. Go over here, grab this. So there would be a history and a physical exam, and that would happen right in our office. I would do some quick measurements, and then we would actually try on some external sizers just to find out how big they were thinking they wanted to be. It's important to note that when I pick a breast implant for a patient, of course, I check volume, I check base diameter, I check skin elasticity, but I am mostly a volume-based surgeon. I've never had a patient come into the office say that they wanted a little bit more base diameter. They always speak in terms of volume. And so we try to speak in terms of volume. And the way that we do that is we do that by first trying on the external sizers, and then we confirm that with the Crisalix 3D, 2D, and 3D imaging. Recently, in the last couple of years, they've come out with the virtual reality glasses, which those of you that have those know those are really nice. Patients just love them. And then what we do is we reconcile that volume request to make certain that their base diameter matches it. So we do match the implant to the patient, but we come at it from the volume standpoint. And that's where the Crisalix system really comes into play. Because now we can pick our target implant, we go to surgery, and we're all set. I've got a little video I want to play here, and there's some sound with it. So you just listen.
Now here we are. This is November 23rd, and we've input our data here into the Crisalix system. And now we're going to use our virtual reality tool. So go ahead and put it on. Okay. Here's our patient. She's going to put on. Now what I want you to do is look straight ahead. Put your head up. Okay, do you see what you look like? Yeah. Okay, now turn slightly to your left. See that? Yeah. Yeah, now turn all the way. Yeah, you can turn all the way to the side and you can see what you look like. Yeah. Turn all the way to your left. Yeah. What do you think?
Oh my gosh, this is awesome. Oh my gosh.
Now turn, look right at me. Now look down.
Oh my gosh.
What do you think?
Awesome.
Yeah?
Yeah.
Turn, look right at me.
Are those the before or afters?
Those are the afters.
Oh my goodness. Wow.
Is that the size that you're thinking?
Yeah.
Something like that?
Yeah.
Yeah?
This is perfect.
All right.
This is crazy.
Is that helpful?
Yeah. This looks so real. This is crazy. Wow.
Can you touch them?
No, I wish. That is fun.
Okay.
Yeah, this is great.
Good.
So I think you can see with that little video, it adds an element of fun to the consult. It's focusing on volume. I don't get all wrapped up in whether or not that image is an absolute representation of what she's going to look like. It's close enough. It's close enough to be useful. And it lets me know what ballpark she's in. And by her agreeing, yes, this is what I'd like to look like, she's signing off on the implant that we pick. So what we did recently is actually done a little study. This has been submitted to the Plastic and Reconstructive Surgery. We asked these questions. Question number 1, are you satisfied with the final outcome of your operation? All 40 patients, 100% said, yes, they were satisfied with the volume. And then question number 2, I said, did you achieve the result you were looking for? In other words, did I do what you asked me to do? 40 out of 40 people said, yes, 100%. Now, it's interesting, and I'm sure many of you have noticed this as well. We asked them, okay, knowing what you know now, would you change something? 5 of the patients said, yeah, I wish I'd gone one size up. They always chose if they wanted to change it, they would go bigger. But overall, they were very satisfied. And then we asked about the virtual reality. And in the virtual reality, we said, did it help you in deciding your implant? 82% said yes, very much, or yes, right here. And then how accurate do you feel this was? And 93% said it was either rather or very, as far as they were concerned. And 78% said very accurate. And then what role did it play in the experience you had with the console? And 88% said it was very important to important. So we found that the virtual reality simulation was ranked the highest here of all of the ways to pick an implant. by looking at photos, discussing with the patient, using external sizers, using the standard Crisalix. The virtual reality was a really useful tool in making that happen. So now how have we done that in the age of the COVID? What we do now is over the phone, we get the initial contact. We give them our unique URL. The patient downloads the photos as Ruth showed. She can experiment with the size with that. Now those photos are in her folder. Back in the office, we can actually make simulations, and we haven't even seen the patient yet. We get all this done. So now we make the contact, we do our virtual consult. We've been using the Zoom through the Crisalix app, and now Crisalix has their own virtual consult program built right into the Crisalix system, which is going to be really cool. What we'll do is we'll confirm the history, assess her desires. I'll share my screen with her. I can show her the simulations that we've made, and then she's ready to schedule surgery as far as I'm concerned. What we'll do is still do an in-person visit. So if we're going to do the operation on Friday, we'll see them on Thursday. I'll do the exam, confirm everything, do the operation on Friday, and off they can go back home on Saturday. This little video clip that we made, very similar to what Ruth just did. The patient logs in, gets her information. My website shows up right on there. There's these simple instructions that are embedded. All she's got to do is one quick little measurement from nipple to nipple. She downloads the 3 photos, just like Ruth showed. And what happens is these photos then get downloaded into the system. It's very simple. All the patients have been able to do this so far. So here she is. She's downloading the 3 views, a 3/4 view, a lateral view, front view, and then a lateral view or a side view like this. She can go into the system then. She's got to give her information so that we can contact her later to set up the virtual consult. And this is what she sees then, a before and an after. And what she could do actually is click and add 50 cc's at a time to each, to her result. So here she is, she's clicking like this, 50, 100. And you know, they always go up to 800 just to see what they would look like. And that's a good thing actually, because if they pick an implant that's too big, now you can talk to them and say, I'm so sorry, that implant isn't going to fit your soft tissue framework. So you can head off problems right from the beginning like this. You can do all the standard views that you can get with the Crisalix like so, like this, 3-view, 3/4 view, lateral view, then the up view like so. And I love this particular tool because you can show the before and the after. It's a very impressive visual that the patients can see. Like this, and we do it from the side because they can see it really well. And then we use this multi-simulation tool, and this shows her between 200, 300, 400, and you can talk about the fact that, you know, arguing about 25 cc's of volume just isn't really very useful, but you get an idea of what ballpark she's looking for, and then you can just make certain that that matches the base diameter of her breast. So she likes the 400 cc implant, and that's the one that we'll target. And then she clicks make an appointment. Our information shows right there. And she says, you know, how do I schedule? And this is when we contact them, and we contact now for the virtual visit. And this all shows up here. Inquiry's been sent. So I think these are going to continue to be a standard in my practice. We've gotten very good at it now. In the age of social distancing, patients are getting used to doing things remotely, and it's really very convenient. I just did a bunch of virtual consults today, and these were all ladies from 2 to 3 hours away. I can't tell you how much they appreciated not having to come in to drive in to see me for something we could just easily do over the computer. So what this also do, I really think is this. Patients that just can't find the time to get in, if they actually download their photos, this could be the first barrier to get them to actually come in to see you. And word of mouth, distance benefits can all be taken care of. And this is very efficient for us and our staff. We'll complete the whole process in 20, 25 minutes now because all of the work was done ahead of time. So, you know, as we get better at this, it's going to become a standard in our practice. Because of the new limitation rules and visiting patients in our office, less patients are allowed at the same time. it's going to be important that we become very efficient. And so really not doing this just isn't an option because we're going to be moving forward. So all of you have seen this quote by Charles Darwin. It's not the strongest of the species that survive, nor the most intelligent. It's the one that's most adaptable to change. Well, we're changing right now in real time, whether you like it or not. And so we've had to adapt. And virtual reality, remote consultation is upon us. But this is a real opportunity for all of us to get better and really seize the day. So this is how we're approaching this in the age of COVID and as we emerge. And I hope that something there was helpful for you. Thank you.
Thank you very much, Dr. Hammond. And thank you, Dr. Hoyos and Dr. Graf. We always love to learn from the best. Huh? So I'm going to unmute all of you so we can go to the questions. So let me. Okay, Alfredo, now you are on mute and.
Perfect. I think Danny, as Ruth is still muted.
Can you hear me?
Okay, now it's fine.
Okay. Mm-hmm.
Good.
Okay, so we can go to the questions, and there are some questions that are directed to one doctor, but I think we can do them also generic for the three of you. For example, the first one is, Dr. Graf, do you charge for the online consultations? And if yes, how much do you charge?
So did you see that in all this platform, in one moment, the patient connected with my secretary. So for the online consultation, I charge half of the price of the consultation in my office. So the patient pays half. And when the patients go to my office after that, I don't charge nothing for the first presential consultation.
Alfredo, Dennis, would you like to say something?
Dennis? So I think Dennis is gone. So for me, I think it's important to charge for the consultation. The only way, the only patients that I don't charge for the consultations are previous patients that require a type of control after surgery, or patients who already contacted me before, But I think it's important to charge for it because it's part of your job, and it actually gives a little bit of seriousness from the point of view of the patient. You get the downside of having virtual consultations is that you can get a lot of patients that are not really interested in surgery, but just want to pass the time and they don't know what to do. And I think it's important that they concrete this. We do it through PayPal and. We can do it, we charge with credit card. I do the same thing as Ruth, we just charge the half of the consult. When they come back, we don't, as we go back and the patient is already scheduled second consult that is going to be face-to-face because they already are interested really in surgery and they're going to schedule. Well, it's literally like an award for them because we don't charge the other half. So I think it's a good way to keep the patients that are not really interested in surgery from the ones that are.
Yeah. Dr. Hammond, are you back?
Yes, sir.
Okay. Would you like to say something about this question on the charging for online consultations?
This is a new normal for us. And so we're still talking a lot about that in our office, but we are charging for the consult. I agree with Alfredo. I think it prevents the people that aren't really serious from taking up a lot of your time. That's one of the biggest problems we have in our office right now is no-shows. So we set aside 45 minutes in the old days, 45 minutes for an AUG consult, and I'd say we had a 25% no-show rate. So I think this is one way to make certain that people are really interested in moving forward.
Okay, I see a very interesting question because that's very new, this new normal. So this question is, how do you assess the psychological aspect with a patient? If it was normally done face-to-face, how do you see that now in remote? with video consultation?
Well, I think that I can still get a pretty good sense of talking to somebody even through the computer. Just looking at them, seeing how they move. You know, we ask them a little bit about that when we go into their social history. You know, do you work? Do you have kids? Who's going to be able to help you recover from surgery? And you can kind of get a sense if there's something that's a little bit off. And remember that in our system anyway, this still involves a face-to-face visit before surgery. And so I wouldn't hesitate to say, you know what, this isn't going to work out if I'm getting, you know, bad vibes from somebody.
Yes, I agree that I think this video consultation is a face-to-face. You can see the patient, you can see the eyes of the patient when the patient talk with you. So you can recognize if the patient is not like has psychological problems. And also you are going to have another consultation after this online consultation. So first is virtual, but the second one is presential. So you don't do anything without this second consultation. So I think this is not a problem.
Yeah, I have the same feeling. Actually, I think it has some benefits, because one of the things that happen here is that we already know a lot of stuff about the patient. We already know about the medical records, about the medical history. We already have seen the pictures. So we already have some advantage there, you know, so we already know a little bit about the patient. And actually that's good for the patient, because part of the empathy is when you read, like, you know, 10 seconds before the calling, you say, okay, this patient actually had 2 kids and she had a C-section and she has allergy to nuts, you know. When you go into the virtual room, you can still see that and still see the patient. So literally the part of empathy for me has been actually easier, because I already know the patient. So it's like, hi, how are you? And we can spend, usually I spend 30 minutes per consult. And the first 10 minutes is just talking, you know. I just start talking, how are you doing with the quarantine? Oh yeah, this is blood, this is this. How are you doing? How are you hanging on with this? Who you live with? No, so I try to understand a little bit more the patient, and you can see something is odd or not about them, you know. And later, the next 10 minutes is just to go the checklist of the medical records. Oh, did you have the C-section? Oh, you have this allergy to nuts, right? And you have this. And later, the 10 more minutes is literally going back and forth with the pictures and showing them, okay, this is how you're gonna look. This is what you can get. This is not what you can get. So I think for me has a lot of advantages, and actually give us like a little bit more the sensation that you're having more empathy with them.
Thank you. I have a question here. I think it's more for Dr. Hammond. Is any plans on how to use the virtual reality glasses now, since we have this concern about hygiene on the COVID? So we should think about how to clean or to reuse it.
Oh, I mean, we're wiping down everything in the office now. We've got sanitizer. We wipe down the computer screens and the keyboards and the door handles, and we just wipe down the screen.
Yeah, I think it has another opportunity here, because, you know, I think now that we have this step forward, I think we can take another leap. You know, a lot of people are gonna buy VR glasses just because, you know, because they have to, you know, go a little bit further into the virtual environments. So, you know, I think the next step is that they can do their own simulation at home with the VR glasses.
Yeah, indeed. That would be a nice feature.
Mm-hmm.
Yeah, Dr. Bensuda is asking, did you start operating? So I think you, Alfredo, in Colombia is not possible yet, no?
No, I already answered in the chat. You know, the government here has been very strict about the quarantine, so has been good in the sense that we have very low rate of cases and very low rate of mortality. But they are reopening in stages, and unfortunately, aesthetic surgery is in the last stage. So we have the notion that we are gonna maybe reopen about first days of June.
Dr. Graf, how is the situation in Brazil?
Yeah, depend of the region. So São Paulo, for example, they didn't open for surgeries. Only they see COVID patients and also emergency surgeries. But we have cities that there is a very low rate of the disease. So we start in my city, not doing elective surgeries in hospitals where we can have COVID patients, but we start surgery in clinics. So in clinics that we don't attend patients with the coronavirus. So, and also we do all these procedures with the individual equipments, protections like the mask, and all patients and everybody in the clinic we use masks, and we use face shields to do some like cosmetic procedures, and also during in the OR everybody use a face shield, and I think we have to protect. Everybody has to be protected.
Yeah, here where I live in Michigan, our state was hit a little bit harder than some by the virus. So we had a very strict lockdown at first, and some elements of that still persist. We are now allowed to do reconstructions in the hospital, and now even second stage revisions, even people that have problems with capsular contracture. So little bit of a loosening up a little bit. And I think that will continue on for the next couple of weeks for us.
Okay. There is a question asking about on the virtual consultations. Do you do them alone, or do you do it with your staff, like assistants or patient coordinators? Who is doing the video consultation?
Well, I think this is more private, and as I mentioned, usually, I usually try to be in a private environment that they don't have mirrors or anything. Patients don't like to have anybody else seeing. That is very crucial when you're doing virtual consultations. That is nobody around, nobody sneaking around. Not the maid, not your wife. No sneaking into a consult, because it's very important that they feel the privacy of this. So usually allowing anybody else to go into the virtual room is, I think, is a little bit troublesome. As I mentioned, part of my patients are patients that are just getting into the step of the virtual consultation. So they are really afraid of showing them naked in front of a camera. So usually that's why we do the online pictures and actually mount them into the Crisalix. So they don't have to do that. We just actually met face to face and just talk.
Yes, I agree that with you, because it's important to have only the patient and the doctor. I do by myself the online consultation. Only my secretary does the appointment, but all this through the platform. The patient doesn't know who is my secretary. She knows only myself. She sees only my face when I talk with the patient. I think this is important. All the concerns, everything that they like in the office, the patients have a confidence in you. So she wanted to talk with me, not with my secretary, together with me. I think it is important.
It's interesting. This is a great question, because we thought a lot about it when we started to do these virtual consults. And what we do now is when I get on the video with them right from the beginning, I say, hello. And it's really a lot of fun. I couldn't agree more with Alfredo. It's like visiting an old friend, through the computer. It's really been a lot of fun. But I tell them, listen, this is me. And then I turn my computer and I say, and there's my nurse. She's going to be taking notes for us today. This is who's here with us right now. So they know who's in the virtual consult room. And then I ask them, who's with you? Because I want to know if their husband is in the background or their boyfriend is in the background or if they're by themselves. And we write all that down in the note because I think there's some medical legal aspects that may end up popping out of this down the road that we'll have to pay attention to. And that's where the HIPAA compliance comes into play. And so then I tell them that the platform that we're talking to them on is HIPAA compliant. I always make a little joke with them here in the United States. I say that means the Russians can't hack into the computer and see what we're doing. Because I do ask them to take their gown down. And just at a glance, normally I can tell, what I need to do. And in particular for my post-ops that we do virtual consults on, I'm going to ask them to take their gown down and I can see how they're healing and how everything's going. And so those are the elements that we've changed a little bit just because it's through the computer and it kind of lets everybody know who's in the room and what's happening.
I have a question for you, Jaime.
Yeah.
Because one of the questions right here is actually how safe it is to do virtual consultations in terms of the encryption and the prevention of hackers getting into.
Yeah, it's a good question. So from the beginning of Crisalix, we have been always having a look to that and trying to be sure we follow the maximum level of security, because at the end our business is in the cloud. So we really have to be sure that all the data is protected. So basically we are a Swiss company and we have to follow the maximum level of security measures, like, as you mentioned, military, banking, but especially the medical field. So the solution is stored in the Amazon private cloud, not in the public, but in the private cloud, which is normally used by many medical companies, big ones, and even private hospitals. And some medical governments in different countries, they use this Amazon private cloud. So at the end, and also what we see in the media and some experts, as Dennis Hammond said, many times the data is much more protected in the cloud than in your personal computer. That can be stolen, you can lose everything, anybody can enter into the practice and get it. The cloud is really super protected and nobody can enter physically even to there.
Mm-hmm.
And even if hackers, they manage to breach the security, everything is double encrypted. So what they will get as data, it will not be readable.
Okay. How about you mentioned me last week that you were going to do your own communication system, like the Zoom meeting or like the Skype. Are you?
Yeah, it's what
it's going to be more trustworthy for us too.
Yeah, it's what Dr. Graf showed in the video. It's going to be officially released tomorrow.
Okay.
So tomorrow you will have it in all the accounts available. And the idea is that you don't have to worry about what tool do I have to use for video consultation? Do I have to use Zoom? Do I have to use Skype? Are they suitable for medical use or not? Here, what we did is to look for a system that is medical proven, HIPAA compliant, GDPR as well. And we directly integrated into the platform. So basically you do the patients can send the photos from home, they can do a booking, and then inside the booking, there will be a system that will send a reminder 1 hour before the booking, 10 minutes before, and then we'll start with one click, the video consultation directly in the platform.
So Jamie, you said that new platform is going to be HIPAA compliant, right? The one that you've developed through the app.
Exactly. Mm-hmm.
Okay. Perfect.
I'm in.
Yeah.
Wow.
It is so convenient to be in the Crisalix app, there's the patient, there's the simulations you've done. Right now it says Zoom. So we get a Zoom invite. But if you got now kind of the Crisalix invite, it's all self-contained. I mean, it's unbelievable how efficient this is.
Yeah, because
especially because normally you, as a doctor in the practice, at the end you have a lot of software, a lot of applications. No, sometimes it's a mess to have so many. So if we can make one tool that has everything inside, it will be easier for you.
You know, I know that Ruth and Alfredo, you give a lot of presentations, we all do, about the only negative in this whole virtual thing. I don't know how you guys feel, but I'm not getting my usual post-operative photos for all my talks.
Mm-hmm.
So that's a problem we'll have to solve somehow.
Yeah, that's true. That's true. Yeah.
And I had the opportunity to use this platform, and I saw that it's really easy to use that, and it really is for the patient also. Just click, and then there is step by step the instructions, and this is a selfie that is easy for everybody. So it's very interesting, very safe, and also easy to use.
There is one question here I see for measurements. So for example, how to assess other measurements for breast implant with this online consultation to make the best choice for the implant.
So as far as the breast is concerned, remember now, like I said, I am a volume-based surgeon. So I pick my volume variable first, and then I'll go for the base diameter. Now you can do a base diameter measurement with the Crisalix app, and the program will give it to you. But I also can tell. I can tell by looking at a patient. She's around 12 to 13 centimeters or 11 to 12 centimeters. If you really needed to, the patient could take a tape measure and they could just measure like this, and you can get the sense of what you need, because close is good enough. Volume for me is the important variable. And so I don't get all psychiatric about this tissue-based planning method stuff. You know, there's an element of tolerance to all of these. And of course, remember now, we're confirming all of this the day before surgery. So I don't have just one implant. I've got a bunch available, and then we'll narrow it down at that final face-to-face visit.
I do the same thing, but one of the interesting things about the Crisalix software is that actually measures the diameter of the base. And based on that, you can choose the implant, and you go clicking upwards and up and up and up, and later it actually shows the number in yellow. And later, if you go further up, actually shows the number in red. So actually says that you're outside the frame of the patient. So it's very cool, because you can see if the implant is go outside the frame. So it's very easy to use.
Yeah, I use the same. I prefer to check the base of the breast, and also in the Crisalix platform, the patients have to measure the nipple to nipple distance to take the picture. Yeah.
There is one question about post-ops. So how do you manage to do the post-op consultations? How available you are for those patients that need a lot of post-ops consultations?
Well, if they don't need to have anything done, it's perfect. You just look at them, answer their questions. We don't have a real complicated post-operative regimen for us. We basically just put some tape on some incisions and wear support garments, and that's it. So it's just really an opportunity for a social visit more than anything else, confirm that everything is going well. If there ever was an actual problem, then that is when you'd have to see them in person.
Yeah, the post-op, for a long time, the next day of the patient goes home, my nurse send a message through the WhatsApp for the patient, asking how she's going, how everything's going, and if she has some questions, or the nurse sent to me, and then I answer, and I ask the patient to take pictures, and then they send me the pictures, and I follow them. I think with the internet, we can follow much more the patient than in the past. The past, you say, "Oh, come the next week." Nowadays, I know about the patient almost every day. It's amazing.
Yeah, well, we have a regimen that is actually, we follow the patients through WhatsApp. Usually when they leave here, we actually just see them 48 hours later, 7 days later, and later 1 month later. The whole idea is that we follow them through WhatsApp and see if there is something wrong. They actually send the pictures right away, and we just schedule a video consultation. And I think that's what is going to happen from now on. Because usually when there are local patients, you say, okay, come tomorrow and we check on you. But I think this is going to change. I think we will need to schedule more video consultations for these patients.
It's interesting because, one of the things that we were doing more and more is when patients would call in with problems, they would send a picture. It was a picture on the iPhone of a little wound breakdown or a little redness. We would see that sort of thing. And that's just an example of this technology was building. It was getting to the point where we were comfortable passing along information, over the internet. And now here we are. So, and we're doing it really, really well. Professionally.
A question from a doctor in New York. It says, once you will restart with the surgeries, are you going to limit what you do due to the situation with the COVID? For example, limiting in time, in treatments that you're going to do, and so on?
So yeah. I'm part of a task force from Latin America. And it's a multi-specialty like group. We have plastic surgeons, intensivists, anesthetists, internists, and infectologists. And one of the features that we have seen is that we revise all the literature that is available about that. And what we could see is that it's only 2 articles that actually show what happened with a patient gets operated during the incubation period of the COVID. And it is not a very good aspect there. There is one that is from Iran, only 4 patients, 3 of them died. So it's 75% of rate of death. And the other one is from Wuhan. Actually, it's 34 patients. All of them have pneumonia after surgery. Most of them had beat surgeries anyway, but the whole idea is from these 34, 17 went to the ICU, so it's almost half of them. And from them, 7 died. So it's 20.4% of death rate. What is important about what we analyzed about that article is that patients above 65 years old, surgeries beyond 200 minutes, and comorbidities like smokers, hypertension, and diabetes were the ones that actually complicated more these patients. So I think we will have to learn to do more like as a 1 patients, so is just normal patients, no comorbidities, younger patients. I think we will have to do less obese patients as well, and we will have to limit the timing of the surgery. So my personal recommendation nowadays, because we're gonna release one of the articles, we already released 2, and we're gonna do a 3rd one for the recommendations to the PRS, and that actually was that's the main recommendation.
Could you say that again? These are patients that got COVID after their operation?
No, actually, it was patients who were in the incubation period. So they were already infected, no symptoms, they had no diagnosis because they didn't have at that time anything that actually was suspicious of being COVID positive. So it was literally they were around like 2 or 3 days from the infection. So they developed the disease after the surgery. So around 4 to 5 days after the surgery, they started to have fever, dyspnea, these kind of stuff.
Wow. Can I ask you, because part of that question was, and something I've been thinking about as well, and that is that it appears that this disease is associated with some vascular problems. Mm-hmm. So we call them COVID toes here in the United States. And that one of the reasons their pulmonary function may diminish so rapidly is because of almost like as a small pulmonary embolus kind of a phenomenon of microvasculature. You start talking about doing big procedures like an abdominoplasty or big breast reduction. We've always been taking precautions about PEs, Are
Mhm.
COVID patients now in kind of a new category where you'd have to use Lovenox and that sort of thing? Yeah.
Yeah, I think we are doing another article about there is a thrombophilia related to COVID-19, you know, so some of the patients develop it, some of them not, you know, but what is important is that most of the patients that had moderate to severe symptoms, they develop that, you know, and one of the keys is mediated by interleukin 6 and 10, and mediated with literally like it's like disseminating intravascular coagulation, you know. So the big question is, if these patients who had the symptoms, moderate to severe, and they survive and they go back to surgery, are they going to have this thrombophilia for a while? I think we will need to have extra measures, you know, and maybe what we will have to do is doing more time for Lovenox or any anticoagulants for these patients, you know, and, you know, the answer is not yet sure. You know, we don't have enough data still to know exactly what is going to happen with these patients. Yeah. That's a very interesting question, you know.
Yeah, in our situation, the main problem is this asymptomatic patient that we are going to operate. This is and we have in the clinic a very strict rules for accept the patients to operate, like Alfredo told here. Young patients not do more than 1 or 2 procedures, big procedures, and combined surgeries like abdomen and breast together. We don't do it. Just no comorbidities, nothing, and pray to have no patients, asymptomatic patients. Yeah.
I can tell you, I think that moving forward for myself, I'm going to be more conservative with how I approach people as far as the magnitude of the procedure is concerned. So for instance, you know, we didn't hesitate to do a mastopexy and an abdominoplasty together. I have a feeling we're going to separate those out, at least for the time being.
Exactly.
There is a question here, but well, it's more technical. I can quickly answer. Is this simulation for body available remote? For now, the option for patients sending images from home is for breast and face. But we are working on body as well. That should be available in a few months. So for 3D simulation for body, it's available only with the iPad and the sensor that we have in 3D in the practice, but not yet remote. Another question here is, do you record the remote consultations?
No.
Well, the idea should be that we should do it, but I don't do it either. Yeah.
So another question is, do any of you do a special consent form to do virtual consultations?
That's a question that you can answer by yourself. I mean, one of the good things about the Crisalix system is that when the patient goes into the system and tries to upload the pictures, it actually has a release form. And the release form is literally a consent, an informed consent for sending the pictures, for doing the virtual consultation and everything. So we're pretty much covered with it.
Jaime, I see there's a question here that says, do we do a COVID test 1 or 2 weeks before surgery? This is something that we have been discussing on a daily basis now for weeks. And we just made the decision today that we're going to get COVID testing on all of our patients that come to our OR, with the idea being that if they were positive, we would delay their surgery if at all costs, if at all possible. So we wouldn't willingly operate on somebody who was COVID positive unless they absolutely needed it. And then if it's negative, then they're quarantined for a period of 3 to 5 days. Now that's not a guarantee that they won't have the disease, but that's how we've decided to approach it from this moment moving forward. some of that has been helped by the fact that we can now have access to a little bit more testing here. That was a problem for us up to this point. I'd like to ask, how has it been in Colombia and Brazil?
Well, Dr. Ruth, go ahead.
But which test do you do? Do a PCR or the EGG? And which one do you do, Dennis?
The uncomfortable one where you get the Q-tip that goes all the way back to your nose, whichever one that's called.
Is that PCR?
PCR, exactly.
Yeah.
So in Brazil, we don't have so many tests to perform. I already asked to buy this, and I'm waiting for that, and it didn't come yet. In Brazil, it's difficult to have tests for all the patients, and also they do only for patients that goes to the hospital like with difficult breath and breathe, and so in Brazil it's difficult to have tests for everybody.
Okay, in Colombia, I think we are more or less very good because we have the two senses. One is the government testing, and the other one is the private testing. And we can literally buy the membrane test. Like it works literally like a pregnancy test. So with that, you can take IgM and IgG. You just test positive or negative. And what we studied with the task force in the study of all the literature and with the epidemiologist that works with us, that actually he is now the counselor for the Chilean government, and he is a brilliant plastic surgeon. He actually established the risk based on the city that you are, based on the number of cases per 100,000 inhabitants. With that, you do selective kind of testing, so let's say that you have a low risk. Low risk is less than 9 cases per 100,000 inhabitants. You only need to do an IgM, IgG test for these patients, and they can go back to surgery 48 hours later after do a little quarantine. The second one is the medium range, that is the Colombian. Right now in Bogota specifically, you can do it by city. So Colombia is between 9 to 99 per 100,000. So literally you need to do an extra testing. That is, you need to do a PCR and the IgM, IgG. But with these two tests, you have very good safety to go to the surgery 48 hours later. The difficult one is the patient that is in high risk. The high risk is literally, let's say that we are going to do surgery in New York, and they have more than 300 per 100,000 inhabitants. What we actually decided to do, and it actually is a very clever way to do it, is that we just do IgM, IgG the first day. You quarantine the patient for 7 days, and later you retest the patient with IgM, IgG plus a PCR. Having done these 4 steps, you have 99% of certainty that the patient is not in incubation period. And the good thing is that it's only one time that you do the PCR. The PCR is very difficult to take. It needs a special training, and it's a very expensive, test. So you need only to take it once. And the IgM, IgG, you take it twice, but it's a blood test that is very simple, no training, no special needs. And it's easier to be available to the main public than the PCR.
Well, it's interesting because we're making all these decisions in real time, like today or tomorrow. And I'm sure it's going to change. Next week, it might be even something different. But
yeah, for the ones that are interested, I can send you all the article and the algorithm for doing that testing.
That's good.
That would be great.
Okay, I think we have to start finishing now. It's been a great webinar. Thank you very much, Dr. Hoyos, Dr. Graf, Dr. Hammond.
Thank you very much for the invitation.
Thank you too.
It was good to see you guys.
Yeah,
Wonderful to see you all.
Wonderful to see you.
Thank
if you
you.
have any other questions, just write an email to info@crisalix.com. and we will come back to you. Thank you very much, everybody.
Thank you very much, everybody.
Thank you.
Bye-bye.
Bye-bye.